Hi, everyone. My name is Carl Fisher. I'm in Scottsdale, Arizona, and I work with the LifeX Research Corp. And hopefully all of you have been prospective agents or are contracted with us to offer this opportunity. And we're extremely excited and really looking forward to a lot more success that we've had and have had with the LifeX going forward. And I'm going to cover a lot of the high points of the opportunity and the products, and then hopefully we'll answer most of your questions during the process. And if you have any questions thereafter, we'll certainly try to answer those or get those to you. And I guess we can move on. Thank you, Stephanie. She'll be operating the slides here. Well, LifeX has been established as a health data research company that seeks very part-time people who are generally relatively healthy, so they can become employees of LifeX. And LifeX employees are called research associates because they're providing health data to the research company. And LifeX conducts ongoing health studies of these eligible recruited RAs, research associates, as they collect health data statistics from them, which enable other medical providers with knowledge and resources to improve health outcomes. Prospective RAs of LifeX may or may not already be employed or self-employed. They can continue their current work situation, becoming a part-time employee of LifeX. It doesn't disrupt what they're currently doing, whether it's part-time, full-time, or in between functions or jobs, for example, makes no difference. After the prospective employees are determined to be eligible, which we'll go into later, to become RAs of LifeX, they're requested to provide personal health and consumer insights data periodically over the year. This health data is easily collected. It takes maybe 15 minutes or less. There's a variety of questionnaires, health improvement videos, and capabilities of them providing health data. It might be a recent physical that they have. It could be some other health visit that they've had that they can provide that data to the company. And that can be done anytime and anywhere on their iPhones, on their Androids, for example, their PCs, their iPads, what have you. It's all done electronically. And again, 15 minutes or less. It's very uncumbersome. It's very easy to do. And the effort is minimal. However, that data is extremely valuable and significant for LifeX research. This health data is anonymous. It's aggregated data. So there's no names connected to that data. So no one has to worry about any HIPAA violations or things like that. That data is shared to individuals as an aggregate. So that data is safe and distinct, and not necessarily, will not violate any confidentiality of employees. Upon becoming a part-time RA of LifeX, the RA is paid W-2 employee payments for that health data that's provided. They are paid by a nationally recognized payroll company, that's ADP, ensuring applicable national, state, local taxes, requisite benefits, workers' comp, et cetera, are all accounted for when paying the employee compensation. And the benefit of being the employee of LifeX, RAs can choose an employer-sponsored group health benefits plan, which is offered by LifeX. That's very important. This is a group health benefit that the employer, LifeX, is providing to their employees when they become employed. That is the business model here. That is the model of LifeX, this opportunity. The health benefits, as any benefits under a group health benefit plan in the U.S., they fall under the auspices and oversight of ERISA, which is the Employment and Retirement Income Security Act. I think it was passed in '73, and it's been in place for, of course, decades now. And that's who oversees the health benefits, not the State Department of Insurances. Nationwide, it is a federal oversight for these types of plans because they're ERISA group health benefits. It's a very distinct and wonderful opportunity for people from the standpoint that many people now in the job market perhaps are seeking employment at a company or an entity of some kind, and the concern they have is certainly pay, but most importantly, it's what type of benefits do you offer? And this is an opportunity where someone can join this organization as a very part-time person, or employee, I should say, and they have to be relatively healthy. That's a requirement. Eligibility to become an employee, But once they do, they're offered these health benefits, and they're very generous. They're very robust benefits, major medical type coverages, ACA compliant, because they all contain MEC, which are MEC benefits, minimal essential coverage, just like ACA plans do. And so that is the opportunity in general. That should give you a good oversight of what LifeX is doing and what success LifeX has had. Let's go on to the next slide now. Okay, here are the companies involved with this. The Network Pros is an exclusive organization to LifeX, and it's their job through all of us to seek people that are potentially eligible to become part-time employees of LifeX. So it's a recruiting organization, Network Pros is, and that's what we do. Everybody on this call, we're not agents, we're not selling health insurance. We are essentially recruiters looking for part-time eligible employees for LifeX. That is what we are doing. Okay, the next slide here shows that LifeX, which I just talked about, BHP, Benefit Health Plan, is the third-party administered TPA for these plans. That means they work for LifeX to administer the health plans, and that would be including the ongoing maintenance of the plans, the network provisions. For example, all of these plans have PPO networks affiliated with them. They manage those relationships with the networks, whether it's a Cigna, PHCS, etc. And that's their function. And most importantly, they're the ones that adjudicate potential claims when people do have use of those health benefits. The other company is KMG Services. KMG is a billing and technology service provider. They're the ones that potentially oversee the ongoing billing of these plans for the employees of LifeX. And of course, we just talked about Network Pros, and I'm sure most of you are familiar with ADP, which is automatic data processing. They do the payroll when the people, the employees, are providing health data to LifeX. They are paid at a rate of $40 per hour. So if they're providing a 15-minute exercise and health data to the company through an enrollment platform, through a portal actually called EWH, Employee Wellness Hub, when they enter that data, they're paid for that. So 15 minutes of $40 would be $10. They would be remunerated for that effort of providing that health data. Applicable taxes and deductions are taken out, and that check and or deposit is made to that person on a going forward basis when they provide health data. Let's go on to the next slide. Okay, so why LifeX? Obviously, you can see that they're committed to collecting and analyze health data, etc. But importantly, medical benefits. That's what a lot of employees want when they join an organization. That's obviously important. Earn money for that health data. We just talked about that. There are 24/7 telemedicine benefits with zero copays extended to all employees. The employee wellness, that is the ongoing health data that they collect and remit to LifeX. They also, LifeX, the company or the entity called Employee Wellness Hub, provides the capability of giving advice and counsel that maybe it's smoking cessation, weight loss, eating habits, exercise regimens, etc. They provide all kinds of services along that line to maintain employee wellness for those relatively healthy people. And of course, public health and through data and strategy, that again is that data is collected by LifeX. They do use that with medical providers, and it's again anonymous and aggregated, so there's no names tied to it. But that data is valuable for the company, and they potentially share that with institutions, health institutions, and so forth. Let's go to the next slide. Who would this be suitable for? As I mentioned early on, it's those who don't have access to benefits. They're in current employment, whether again self-employed, gainfully employed working for a company, or a 1099 worker, or a gig worker. Anybody that doesn't receive ACA subsidies, and of course, it could be an uncovered partner of Medicare recipient. The 68-year-old person may have, married person may have lost their coverage because they retired, and their 63-year-old spouse needs coverage until they retire, and this is a good option for them. Who's eligible to be a part-time? They have to be willing to share personal health data and consumer insights through those questionnaires and health experiences that I talked about earlier, and the applicants and the dependents, if they have some. Obviously, if it's a single person, that's just them. If they're married, if that person is married, their spouse would be included. And if they are a person with a spouse and they have dependent children, they all must demonstrate eligibility by completing the health questionnaire for qualification to become a part-time employee of LifeX. Go to the next slide. Here is the employer application. It's not a health questionnaire for insurance. It is an employer application to determine if that prospective employee, and of course, there are any applicable spouse, domestic partner, significant other, or dependent children would be included to answer questions on all of their behalf. And as you can see, questions like organ failure currently, yes or no, any genetic condition, etc., cancer requiring chemo, radiation, etc., inpatient mental health or substance abuse or alcohol treatment. We'll go on to the next slide. And you've listed any individual currently pregnant or expecting a parent, or they seeking to receive infertility services to become pregnant, because they would be relatively healthy. They're looking for relatively healthy people. Part C, there's a number of other questions in the last 5 years. We can go to the next slide. You can see there's a host of questions. Obviously, the questions in this employment application must be answered no in order to be eligible to be offered employment with LifeX, and then subsequently, if they are offered employment, then they can choose what type of health benefits they wish to get for themselves and or their families. That is what works here, how it works, the model. And then we also state that they're looking for relatively healthy people. So someone with cancer or current heart disease of some kind, or a host of other maladies that they talk about. In this case, type 1 diabetes would be one malady that would be not eligible to become a part-time employee of LifeX. That's the type of people they're looking, because they're doing health data research on relatively healthy people. So there's a lot of studies, a lot of regimen that's studied on individuals that have heart disease or cancer or MS or whatever the affliction may be. Tons of data on those types of people, but very little data on relatively healthy people as to what their lifestyles and background are that make them, kind of a step above, if you will, of others that have a lot of health afflictions. Extremely important. PhD, this is actually the nomenclature is wrong. This is a personal health dashboard. They've changed the identity of the portal. It serves the same functions as I described, but it is called Employee Wellness Hub, EWH. And it is a portal that once they become employees of LifeX going forward, they would use that portal to access the capability of the wellness functions and programs that LifeX offers. They would have the capability of uploading their health data through that portal. They also have the capability of doing their health benefit information on their plans that they purchased as an employee of the company, as well as their ID card as well. All of that's in that portal. We'll go on to the next slide here. Again, there's a host of things that they'll be able to track their health going forward, their wellness, that employ through the wellness hub itself. And there's a host of models or programs that they can participate and monitor. We'll go to the next one, please. Thank you. Again, client view, as I mentioned, all the telemedicine. They can schedule a coaching call with a medical practitioner if necessary, monitor their prescriptions. eating profile assessments, health risk assessment, etc. Again, that's EWH, not PhD. So, okay, once they have employment with LifeX, they've covered themselves and or their families, depending on their situation, they are offered these health benefits going forward. And we will cover them in a high level, but I'll cover the first couple of ones here that are most popular, they're most prevalent, and make choice making for those employees that join LifeX. This is probably a vast majority of members select this plan. It's extremely benefit rich. It's very, very competitively priced. And so it has a lot of fabulous features that make it attractive. That's why it's so popular. This has to be called an EPO, and that's exclusive provider organization, of course. And it's not a specific network that is different. It's just identified as an EPO because this plan, very robust benefits, but it only has or uses the Cigna PPO network nationwide. The Cigna PPO network nationwide, their largest network, is used nationwide. So they have a preponderance of medical providers, facilities, the Mayo Clinic here in Scottsdale, et cetera, Cleveland clinics, so forth and so on, as well as, of course, a very large population of doctors and medical providers. So it's extremely attractive, but it is specific to the EPO, specific to the Cigna PPO network, meaning that they can only use benefits in the PPO network for Cigna. They want to go out of network to a medical provider. The plan does not provide any benefits. The only exception to that is for obviously ultra emergencies. Someone has a sudden heart attack and they're traveling to some place out of where they live. Obviously, they're going to take them to the nearest medical facility for assistance and for care. They will work then to try to get them into a network facility included under the Cigna PPO network is what they will do. Again, the exceptions are for emergencies only. And of course, then going forward, they must use the Cigna PPO network. You can see the variety of deductibles, 500 up to 1,500, pretty low deductibles, meaning there's not a lot of out of pocket to get benefits here. And that is for 500 as a single there, and then 1,000 is the maximum deductible for a family. Let's go to the next slide here. Okay, as you can see, the deductibles vary from 500 to 1,500. And then what we'll also look at is the out-of-pocket maximum. That is the same for any deductible. 9,200 for single, 18,400 for a family. Let's go through the PCP visit, $50 copay for their primary care physician after they pay that $500 or $1,500 deductible. Specialist, same thing, $50. Urgent care, $50. They really encourage people to go into the urgent care facilities versus the emergency rooms, which are much more expensive. Chiropractic therapies, labs, etc. Again, these are all copays after the deductible has been met. Emergency room care, as you can see at the bottom, that's a $1,000 copay. So they really want people to go into the urgent care. A $1,000 copay on an emergency room is not too bad after that deductible. Just going in the emergency room will be $2,000 or $3,000 minimum. I've seen the many claims and many experiences. It's certainly not $1,000. It's $2,000 or $3,000, or could be a lot more. Let's go to the next page for benefits. Ambulance and air ambulance as well. Higher copay there. Inpatient hospital, $2,500 copay per admission after that $500 deductible. Inpatient surgical, again, $2,500 copay for that surgeon after the deductible of $500 to $1,500 is met. And think about this. We'll just stop at this point. So someone does need a heart bypass or what have you, something that might cost $50,000, $100,000. They're going to pay that $500 deductible. They're going to pay $2,500 for the copay in the hospital, inpatient, $2,500 to the surgeon. It's $5,500, and they will have that much out of pocket. They've got a $50,000 to $100,000 procedure being performed. What a robust plan. Very competitive. Very competitive. Remember the $8,400 out of pocket, or $9,200, excuse me, out of pocket maximum that I mentioned earlier. That is for all these copays. So they would have to have, 4 almost of these inpatient surgical services over the course of a year, and then they've met the out-of-pocket maximum, and then of course everything's covered thereafter. So it's a very robust major medical type plan. Again, organ transplants, as you can see, are covered here. Very important. Organ transplants, $2,500 copay. Outpatient services, I'll draw your attention to the bottom. Outpatient chemo and radiotherapy, a $250 copay per visit after that deductible. So they could go in 8 times or 18 times. The cost of the chemo radiotherapy might be $8,000, or it could be $22,000. They pay that copay for each service, and it's covered after that $500 or $1,500 deductible. Same thing for infusions or injections for like cancer type patients. We'll go to the next page. Dialysis, there we go. That's also covered with copay, what is needed. Preventive care, those are the MEC benefits I mentioned, all the annual wellness exams, the labs, the pap smears, mammograms, PSAs for men based on their ages, just like MEC benefits for ACA plans. 0 copay, 0 deductible. They must use those benefits in the PPO network for Cigna. In the PPO Cigna can't go out of network. They have to use the network facility for those 0 copay, 0 deductible benefits. Maternity is covered. $2,500 copay for maternity, for routine vaginal or C-section. And then of course, again, it's after the deductible. And then all of the routine maternity services are covered. The complementary type services for routine maternity are all 100% covered. Home health care, durable medical equipment, prosthetics, allergies, copays on allergy shots. That's depending on where you live and what the circumstances are. A lot of people have allergies, and there is a copay after the deductible for those, whether it's shots or visits, testing. Next slide, please. And here I want to point out they have benefits for pharmacy on this plan, but what makes it unique and also helps the cost being maintained at a lower level is the fact that it covers generic drugs only with no copay. They don't cover preferred brands or non-preferred brands or specialty drugs whatsoever. I want to make that really clear, because if they're already taking some type of name brand preferred specialty type drug, this plan will not cover that. They have to then be referred to a patient assistance program, and PROACT, which is the PBM for this plan, would be contacted, and they will work with the client based on their income and circumstances and what have you, and attempt to get those types of drugs that they do need at a lower price through a patient assistance program that's available to them. But that also keeps, again, the price of this plan low. Again, these plans and employment LifeX is for relatively healthy people. So it probably wouldn't be very common for them to be taking those kinds of drugs. But to make you aware of that, you would make the client, potentially the employee that you're recruiting, aware of this type of benefit on this plan. Great prices, and which we'll go to next. And as you can see, that $500 PPO plan is this for a young person, $429 for 18 through 29, $369 for 1,500. That's a difference of $60 a month from 1,500 down to 500. Very interesting. That's only $720. That's less than the difference of that deductible, which is $1,000 between 500 and 1,500. And as you can see, there all the plans are priced that way. which is really favors the $500 deductible plan. You go to somebody 45 to 54, $519 a month for a plan I just described, a very robust major medical comprehensive plan for an employee, $519 for a family, mom, dad, 3 kids, what have you, under $1,200 a month. Again, it's a single PPO plan. That's why it's called EPO, but it's the Cigna PPO network. Wow, what a value. You got a retiree there, the 63-year-old spouse of someone, $569. Compare that to an ACA type priced plan in whatever market. Keep in mind, these rates are universal in the 44 states that these plans are available in. So whether you live in Los Angeles, Des Moines, Iowa, Dallas, Texas, or Nowhereville, Kentucky. I don't want to make fun of people in Kentucky, but it doesn't make any difference what zip code or what area you live in. The rates are nationwide. Very, very interesting. Point that out. Let's go to the next plan, please. This is the an up and rising plan that's more available and more attractive for a lot of people. An HSA. This is a traditional major medical type plan. You can use either the PHCS PPO or the Cigna PPO on this plan. You have 2 available networks. And thirdly, you can go out of network if you wish to do so. But of course, there's always a price to pay when you can be able to go out of network. That allows you to do that, but the cost of the plan will be a little bit more. This plan also has a host of much better levels of drug coverage. I don't believe they cover specialty drugs here. We'll see that in a moment, but the point is they cover more of the brand name or preferred brand name drugs if needed. So someone in that category that's not relatively healthy but needs that might want to consider this plan versus the other one if they need those types of drugs. As you can see, there's 3 different deductibles. Health savings account is a fabulous way to save money personally in your account. Let's go to the next slide. As you can see, this is traditional now. They have the deductible, then there's co-insurance. It's 80-20, so 20% is, of course, what the employee would pay out of pocket. If they go out of network, they're going to pay 50% versus the 80-20 on the in-network. And of course, excuse me, there's an out-of-pocket maximum on this as well, $8,517 for a family, as you can see across the board. It also, of course, has the NEC benefits baked into it that are 0 copay, 0 cost when they use those MEC benefits, those preventive services in network, whether it's PHCS or Cigna. We'll go to the next slide. As you can see, again, we have a suggested copay because the HSA is first dollar. You have to go through the entire deductible before benefits, but it is a 20% after the deductible copay on physician, specialist, urgent care, etc. All the plans have telemedicine, as I mentioned before. Emergency services, again, you've got your copays going on, a traditional major medical type plan. Labs and x-rays, $25 copay after deductible, $100 copay for x-rays. Diagnostic, we have a pre-cert there, it's 20% after deductible, and so forth. And you can see that's applicable to inpatient hospital services after the deductible, 80-20, up to the maximum out of pocket. Preventive services I mentioned, therapy, pregnancy is covered, hospice care, excuse me, durable medical equipment, organ transplants are covered, allergy again, traditional major med features or methodology for payments. We'll go to the next slide. Again, excuse me, retail pharmacy. This makes this plan different. As you can see, there are benefits for everything except for the specialty drugs. The patient assistant plans are available for those specialty drugs, but anything else, even including GLP-1 medications, as you can see, for a qualifying member that's not covered for weight loss, they require that type of drug that is included with a copay. As you can see, there's copays for the various levels. Generics are the lowest with 10. Preferred name brands and what have you go from up to $90 or $110 based on what the drug is, what tier it may be. But that's what also makes this plan more rich because it has more pharmacy benefits, traditional HSA, and again, PROACT is the PBMs we can see. Let's go to the rates, the next page. And as we can see here, and I'll just call it PHCS. We might want to go with Cigna. Of course, it is a little bit better network because it's probably got more facilities, doctors, but they are very close. And obviously, you'll want to take a look when you do some discussions with these recruits that you've recruited, now RAs, when they choose their plans, that you would want to look up their doctors' preferred institutions in each network. You might be surprised that PHCS does have a pretty robust network. They do include a lot of named facilities. So anyway, let's look at the difference in prices. PHCS is $543 on this plan. That EPO is, of course, around 400, whatever that number was. I forgot offhand, but you've got obviously a higher price because you can go in or out of network. You've got more pharmacy benefits here. But the price is still very competitive compared to ACA plans. We go to somebody 45 to 54, 584 for a single on PHCS, 645 for a Cigna network. Again, pretty competitive. You go to families, it's a little around 1,500, a little more than that with the Cigna network, but very competitive again. Again, priced nationwide, whether in Miami or LA or Des Moines or Norfolk, Nebraska. There you go. Very competitive rates. Let's go to the next slide, please. And I'll just talk about these plans at a high level. This is a plan that's been around for since early last 2025. It's called the VL because it is a visit limit type plan. It'll be very low priced, which is wonderful, but it's also more restricted than the other plans. It still has a lot of coverage and benefits, but you'll see, so look at some of the pages here, it does limit the number of visits you can make. And that's what was more restricted. Doesn't limit the dollar amounts by any means. So it's ACA compliant, but it does have visit limits. And again, the 250 deductible, that's an older one version that is not sold going forward. That's not available anymore, only the 500 to 1500. Let's go to the next slide. And you see here, okay, deductibles, as we talked about, and which are not deductibles, but excuse me, copays, essentially, or a deductible is what it is initially, but also with copays, which will cover. But you can see the out-of-pocket maximum 10, 6, and 21 versus the other plans a little bit higher. It has all the preventive coverage in here for preventive services, zero copays, full coverage when they go in network. PHCS or what, and this particular plan only PHCS. Let's go to the next page. What I want to show here we go. After the deductible of 500, for example, then you have copays. But as you can see, for example, physician services, they have 10 visits per max benefit year maximum on this. So you can go to those urgent care specialists, primary care, with a $50 copay after the deductible, but you can only have 10 visits per benefit year. That's the restriction on this plan versus the EPO, which we covered as the first plan. And it goes on to the same types of parameters for emergency services, 2 visits, for accident-related visits in the emergency room, etc. Labs, same thing. There are visit limits or system, or I would call it category uses is better description. Category uses where it's limited to 3 visits of X-rays per year, 3 categories per year. Outpatient, same thing. We can go to the next slides. Okay, and again, I'm not going to repeat everything. It's very redundant, but you get the idea. You can look at these brochures on your own. Let's look at the drugs. Again, one back. I'm sorry, Stephanie. But again, this is very similar, like the EPO. All of the benefits for anything beyond generic drugs are not covered. So the preferred brands, especially, of course, non-preferred brands, no coverage. That keeps the price down, in addition to the visit limits. So I want to point that out. Now I can go to the pricing. And as you can see, that's really obviously $349 for someone, $329 for someone at $500 deductible. 18 to 329, you go to somebody 49 to 54, a relatively healthy person that very infrequently goes to the doctor, hasn't used health benefits, or looking for just something to protect them for, what if I get something really catastrophic. 45, 54, $421 a month for a $500 deductible with those benefits we described. Very competitive. You got a whole family there for around $1,000. You got the person that's 63 years old with a retiree, and it's $473 a month for a $500 deductible. Again, compares very favorably to any kind of ACA type plan. We'll go to the next and final one. And this is a traditional major med. It's very similar to the HSA we described, but it's just a traditional non-HSA, $1,025, $3,500 deductible. It uses the PHCS or Cigna network, so you have a choice. Let's go to the next slide, please. Deductible, and then it's 80/20 co-insurance. You're going to have a 50/50 if you're going to go out of network instead of going in network. And of course, the rest of the benefits are pretty much identical. You got your zero copay preventive, etc. We'll keep going. And matter of fact, let's go to the drug slide. There we go. And as you can see, this plan, traditional major med, like the HSA, but you can go in and out of network, of course. This does have more robust drug benefits. Again, no coverage for specialty drugs, patient assistance only, but anything else, as we described in the HSA, is covered with essentially, I think that mirrors the same copays as the HSA plan. So it's a traditional major medical for those people. It has more robust health coverage. Now let's go to the prices. And here, let's look at the 18 through 29. You got $1,000 deductible, very low deductible, $811. This is going to be a more expansive plan. This is a rich plan. You have a $3,500 deductible. If they're maintaining that higher deductible, their price comes down to $635 for that younger person. We'll look in the middle with a $2,500 deductible. For example, somebody 45 to 54, $875 a month for the PHCS, $936 for the Cigna network with $1,000. You go to the $3,500, that reduces down to $769. You save almost a little less than $200 a month. So that's an economic choice, but this is a very robust, full-fledged major medical, comprehensive, in and out of network, robust drug benefits that we also sell, or make sure it's offered, I should say, to our employees. Okay, Humana plan rates. I'll talk about this first. This has been newly introduced just in the last few months. And I'll say it, hopefully it'll be updated the next time I do some of these future training sessions, but the benefits are very robust. There's no waiting periods. These are true group, employer group dental plans from Humana. However, and they're very, very, again, great benefits, but the current issue that we have with them is that there's been a kind of a disconnect on the technology between LifeX and the Humana organization. And we have a great relationship with them, but the technology has been an issue in in the last month or so. So in offering these plans, members are getting, it might be 4 to 6 weeks before they get their ID cards. And I hate to even share that, but at this juncture, if you are going to be offering that, you can offer this when they purchase a health coverage plan. When the recruited person chooses any of the health plans, any of them, they then can so potentially select a Humana dental plan. And they cannot offer the Humana dental plans standalone. They're not offered that way. Cannot be. They must be offered only if the person purchases a health benefit as an employee. Then they can purchase the Humana dental plan. But the issue we're having right now is those ID cards and the functionality between the two companies is not working. And so a lot of the cards have been delayed. So a small amount of people that have chosen this so far are having some issues getting their ID cards. And that might be obviously going to be confusing, and it's going to be disappointing to them to be paying for something they can't necessarily access for a matter of weeks before they get this ID card issue ironed out. But I want to point out it's very attractive. Hopefully in the future training session, I can share that. As you can see, the rates are phenomenal. They have a vision plan as well, by the way. That's it's $10 for an employee, $30 roughly, $29 for a family. Very competitive. That happens to be through VSP, but it's offered through Humana. Here are the dental plans. There are specific benefits that are required in a handful of states, which is Alaska, Georgia, Louisiana, South Dakota, Texas, West Virginia. Those plans are $52 up to $184 for a family. Again, first day coverage, no waiting periods, it's group coverage, unlimited benefits. It's a fabulous plan. I hate to say wonderful things about it because we're having some issues with those ID cards being issued on a timely basis. And as you can see, then the other plans in the other states ranging from around $50, $49.50, $60 up to $220 based on the benefit levels of each plan, but they are pretty attractive. You can go to the online source, your portal with USA Insure, as well as I believe there might be an online portal or application or app that allows you to see the benefits. I don't cover the benefits in this training session necessarily, but I'm making you aware that it is available only those right by the Hill. We're having those ID card issues right now, so be aware of that. Be cautious. You can offer this, but it's unfortunately going to be something they're going to have to wait for until I get knocked out in the next few weeks. Let's go to the next one. Proact, of course, I've mentioned them. The PBM. They have obviously toll-free numbers for people that need assistance in getting their mail order, prior authorization, or getting online resources as necessary. We'll go to the next one. Telemedicine program, and it's available on all plans, 24/7, as you can see, comprehensive. It's all done, electronically, digitally, remotely, virtually. We'll go to the next one. Okay. We will be talking in a future training session and probably have a separate one just for a platform. USA has a different platform than the rest of the LifeX organizations or marketers use. It's a more modern tool. We believe it's much easier to use and navigate. Let's go to the next screen. There's a whole host of FAQs. Again, I think this is going to be posted on the USA back office or portal for agents. So under the, I believe the training tab or that category, all these things will be available to you, and it'll answer a lot of your questions potentially. And we'll just finish that. I think we're done at this juncture, and we made it in about 45 minutes, which is good for attention. And I'll stop here and entertain anything I can answer or try to get answers for you or clarify.
Thank you so much, Carl. Yeah, guys, if you have any questions, please feel free to drop it in the Q&A. We will be sending out, I saw that there were a few people that came in late. We will be sending out the version of this recording in case you joined us late. Yes, so Margaret, actually that way you got your question in before it could answer it. Yes, so we will be sending out the recording of this, as well as the PowerPoint is available in your back office for you guys to be able to review it. Were there any other questions that we could see here? Got another one. Okay, so other than the question about the recording, does anybody else have any other questions that you would like Carl to clarify for you regarding any of these plans or anything about LifeX? No?
Okay, well, thank you all for attending today. I appreciate it. Hopefully this enlightened you and it educated you on what the LifeX opportunity is. We think it's fabulous, it's wonderful, and we've had tremendous success and want to continue to do so. And look forward to working with all of you, and thank you again for attending. Have a great rest of the week.